Good afternoon and welcome to our Facebook Live on COVID-19 and the heart. These have been stressful times and our communities have been really challenged. The normal rhythm of life has significantly changed. My name is George Ruiz. I am the Chief of Cardiology at MedStar Union Memorial, Good Samaritan, and Harbor Hospitals. I want you to know that although our life has changed, our commitment to our patients' health remains completely the same. Your care is the reason why we come to work, and that has not changed. COVID has forced us to rethink how we approach caring for patients. So although many of our waiting rooms are empty, we have shifted towards new and creative ways to provide care. We have launched an amazing effort to use technology to keep our patients healthy and moving towards their goals. Using both telemedicine, phones, and emails, we have been able to meet patients where they are. It's been powerful for me to see many of our patients on computer screens and keep their care moving forward. And as we get COVID under control, we want you to know that we'll continue to be there to help you and your families. If you don't feel well, if you're having cardiac symptoms that are worsening, I want you to reach out to us. Our offices are open, our phones are working, and we'll find a way to get you the help that you need. So in an effort to equip you with knowledge around COVID, we decided to do this Facebook Live, specifically around COVID-19 and its effects on the heart. In an effort to try to understand some of the questions that are out there, we've been able to collect some of the questions from the community specifically about COVID and the heart, and my hope is over the next several minutes to try to address them. Our first question asks specifically about the relationship with the heart. One of our patients emailed in, I know that COVID-19 affects the lungs, but now I'm hearing that it may affect the heart too. How does that work? Well, I think before we even get there, I think that a lot of the conversation around COVID has really taken for granted the fact that most people understand what a virus is. And it's important that when we think about infectious diseases, we often try to distinguish viruses from other types of pathogens that try to infect and harm us, like bacteria, for example. So it's important for, I think, the folks that are listening to understand there is a difference between the two. Bacteria are often one-celled organisms that have a specific cell wall around them, and they tend to replicate, often independent of you or me. Viruses, however, need a host. They need someone like you or me in order to replicate. And so many of the things that happen with viruses are inside our cells. They basically hijack the way that our cells work. They take over the machinery of our cells in order to reproduce more viruses. Now, the reason this is important is because each of them have a fundamentally different way of being treated. Often bacteria, as I mentioned, that are standalone organisms, these are often treated with antibiotics. Viruses, however, antibiotics generally are not the way that we approach viruses in general. They are treated with antiviral medications. And antivirals are basically go inside the cell to try to disrupt the way that the virus hijacks the mechanisms of the cell. So as the virus tries to take over the cell and reproduce more of its own, antiviral medication will try to block it. Now, what we found is that COVID-19 gets into the cells of the body through specific receptors. And many of these receptors reside in the lung. And what can often happen is that the virus can then infect tissues in the lung, leading to an injury of the lung. And this injury can sometimes be exacerbated, made worse by the inflammation that follows. So it's not only that the virus has infected, but it's also the response that the body takes in response to the viral infection. Sometimes this inflammation can be robust and it can lead to injury of any one of several organs. Now, throughout the pandemic, we have focused primarily on its effects on the lungs. Now, it's important for the folks that are watching to understand why that matters. The lungs are the main way that we get oxygen from our environment into our body. And oxygen is one of the key things that are needed in the metabolism of cells in the body. In other words, most of the cells of your body need oxygen in order to function. And the way that we get that oxygen is through the lungs. So if something injures the lungs, like for example a COVID infection, this can really compromise the body's ability to take oxygen from the environment and incorporate it into the cells of our body and into the day-to-day metabolism that we need in order to live. And so what ends up happening is if the lung is severely injured, then we can't bring oxygen from the atmosphere into our body. The oxygen levels in our body drop, and then the tissues cannot work well. And that's why you may have heard of several patients with COVID that have these problems with what we call oxygenation, getting oxygen from the environment into our bodies. And in those situations, what we typically do is we provide the patient with an oxygen-rich environment. We give them oxygen, enhanced oxygen through a mask, through nasal cannula, and sometimes in extreme cases, we may have to intubate the patient, which means that we connect them to a breathing machine. So in the case of the lungs, it's clear that that is one of the main targets for COVID. We have found in a subsegment of patients that the virus may have an impact on the heart. Although I am not aware that there are direct reports of the virus infecting heart muscle tissue, this inflammation that gets set up as a result of the infection can lead to the heart finding itself in the crosshairs of that inflammatory process. And that inflammation can extend out to the heart, causing inflammation of the heart tissue itself. That's called myocarditis or myocardial inflammation. The other thing that happens is that the demands of the body on the body are increased. I mean, these are things that you know. When patients are sick, their bodies need a lot of energy to deal with the illness. And as a result, the energy demands of the body increase. So the heart is the main organ that supplies the body with the energy that it needs in the form of oxygenated blood. And so if the demands of the body increase, the main question is, can the heart supply that increased demand? And in patients that may have pre-existing issues with their heart, be it coronary artery disease or heart failure, you can see how an increase in the demands of the body may not always be met with an increase of supply of blood from the heart. And that mismatch can often lead to significant problems. So that's why sometimes we will find that patients may present in the midst of having COVID infection with injury to the heart. They may have small heart attacks, for lack of a better term. They develop myocardial, which is the muscle of the heart, myocardial injury. And so for us, when patients come in and they have evidence of myocardial injury, what we're trying to focus on is the reason why. Is this because the demands on the heart have been greater? Is it because the patient is in the midst of a heart attack that's been triggered by that increased demand? Or is the heart muscle itself inflamed because of all the inflammation that's happening around the body? By the way, I hope you can hear me well. I'm coming to you live from the hospital where we're all wearing masks. So in today's example, this is not a prop, it's actually we're here. And the folks who are here in the room with me, we're all wearing masks, which leads to one of the recommendations now here in the state of Maryland. Most of us are wearing masks when we go out in order to protect ourselves and others. So can COVID-19 impact the heart? Yes, it can. Can it do it by increasing the demands on the body in a heart that may already have issues that are maybe compromised? Absolutely. Can it lead to inflammation that can then cause inflammatory changes in and around the heart? It appears that the answer is yes. But overall, it appears that it's a very small percentage of the patients. It's not a large percentage of patients that develop these complications. Okay, let's see what other questions have come up. Does COVID-19 affect everyone's heart the same way? Well, I think we kind of laid the groundwork for some of this already. It does not affect everyone's heart the same way. Actually, some patients, it doesn't affect their heart at all. And the reason why this is important is because one of the things that we're doing is to try to distinguish the reasons why when patients do come in with any injury to the heart in this era of COVID, is to try to figure out what role COVID is playing. Has it just increased the demands and the heart has gotten sick as a result? Or has the heart been directly injured by COVID and the muscles inflamed? And so in order to do that, we often go back to many of the tests that we currently use, that we used before the COVID pandemic. Patients that present with significant EKG changes often have to undergo cardiac catheterization in order to define whether or not the heart arteries themselves have any major blockages that are limiting flow. And in those situations where there's evidence of heart injury and there are no major blockages, then we can really hone in on the heart muscle and inflammation to the heart muscle as an underlying cause. We've also found, and it's interesting to point out, that sometimes it's not the heart itself that's having the issue, but the tissue that's around the heart. So we have had some cases of what we call pericarditis in the setting of COVID. And that is where the heart has a bag around it of tissue called the pericardium, and sometimes that tissue itself can become inflamed. Now that should come as no surprise, because if the lungs around that have become inflamed, then that tissue around the heart may also become inflamed. And we have had some episodes, some cases like that. So it's important to point out that there are lots of different reasons why the heart can find itself in a tough situation because of COVID, and a lot of what we do is trying to figure that out. So one of our patients emailed in, are there patients that are taking statins or beta blockers? Are they at increased risk of getting COVID-19 or having complications associated with COVID-19? Well, we know that several patients that have had risk factors or comorbidities are at increased risk of developing COVID. And one of those is hypertension, high blood pressure. High blood pressure is one of the risk factors for developing coronary disease, that is cholesterol buildup inside the heart arteries. It is also a risk factor for stroke and developing peripheral vascular disease, which is blockages in the arteries in the body that feed the main organs of the body. We know that many of these patients, because of that cholesterol buildup and the hypertension, are on a combination of statins, medications that reduce the cholesterol levels, and antihypertensives, medicines that bring down the blood pressure. So it should come as no surprise that the patients with those medications sometimes are getting infections with COVID. And we know that if they have comorbidities, if patients have comorbidities, which often happen as patients become older, that those patients are more susceptible. A very interesting piece of this is the use of ACE inhibitors, because we have found that one of the receptors that COVID uses to get into the body is a receptor that falls in the cascade of chemicals related to angiotensin. And that chemical is one of the chemicals involved that is blocked by the angiotensin converting enzyme inhibitors, ACE inhibitors. And so there's been a big focus around whether or not ACE inhibitors are actually helping or hurting in these cases. And although there has been nothing yet that's been conclusive, to date, we have openly recommended that patients not stop these medications at the present time. But then it's important that they continue taking them, because we know that they could have very important effects on the heart and the circulation. We're still trying to figure out a lot of how all of this interacts with COVID-19. So that's a very important question. Are there some other questions that we've gotten from patients? Included this one. I'm recently home and recovering from heart surgery. For patients who are recovering from a recent cardiovascular procedure, are there specific recommendations for what they can do to help minimize the risk of catching COVID-19? Well, this is something that we think about a lot, in particular now when we feel like patients are coming in with procedures that are not really elective, patients that have non-emergent but a urgent cardiovascular condition that needs to be addressed. So even though COVID is sadly running through many of our communities, a lot of patients with pre-existing cardiac issues still have a need for care. And their symptoms of coronary disease or other issues may become exacerbated, make it worse during these episodes. And so if they come in for a procedure, what do? Well, we have to weigh the risks and benefits for each individual patient. And then we also then have to see if we can bring them in and safely get them through, and then on the tail end, care for them well at home. And so for the patient who had recently had for example, a cardiovascular procedure, including coronary bypass, the key is to stay at home and to do what many of us are doing: social distancing, trying to find a reliable way to get resources brought into you, whether that be the food that you're eating or the help that you need, and then connect with your cardiologist and cardiac surgeon now through new ways of doing things, such as telemedicine, which we have completely set up a whole new program so that we can see you at home. And so this has been a very important way for us to continue the care that we deliver moving forward in spite of the fact that we're in the middle of a pandemic. Thank God that we have this technology and that we're embracing it rapidly. So my advice to that person would be to follow what they hear on television from the CDC, which is keep a safe distance from folks, try to cover themselves when they exit their home, try to limit their exposure to other folks, and to try to minimize the contact with anyone who could potentially be infected. And then in addition, connect with your health team through telemedicine if possible. This one I thought was really particularly important. I was in a cardiac rehab program, the patient says, but due to COVID-19, it is no longer available. What can I do at home to make sure I'm not losing the progress I've made and at the same time move forward with the program? Well, that is super important, in that cardiac rehab is an instrumental way of getting you back to health. And that has always been the goal, is anyone with cardiovascular disease, it is to get them back to their previous state of health. Cardiac rehab does that very effectively. Sadly, because of the current pandemic, we have not been able to have our formal cardiac rehab program come together. For the reasons that you can imagine, we don't have lots of people in the same room. I'm actually here sitting in a very big room, just two of us, filming this video. But for the same reason, we have not been able to bring together our cardiac rehabilitation classes. That being said, our cardiac rehab program has actively reached out to our patients and given them exercises that they can do at home. So although there is a big difference between being at home and being at a gym where you're working with your partners in order to improve your cardiovascular health, there are lots of things that you can do at home to stay active. That can include exercises right in your room that can keep your heart sustained and keep your muscles moving. So if you haven't heard from your cardiac rehab program, please reach out to them. I know that we're actively reaching out to our patients in order to get an at-home regimen so that you can keep your progress moving forward. So I think, there's some questions here from our viewers. Shelley, okay, so, all right, so here we go. Have you heard of vitamin C and corticosteroid early on treatment to avoid intubation? Well, we have heard of that. And I'll tell you that right now, we are currently trying to figure out what the right strategy is. Physicians and healthcare in general has really relied on trials in order to understand what the best process is. So what is a clinical trial? In a clinical trial, they take two groups of patients that hopefully are very similar to each other. And one group gets the intervention that you're curious about, and the other group gets whatever the standard is at that time. And then they follow these patients forward, prospectively is what we call it, a prospective trial. And then they, at the end, count to see how many patients did well in this arm, in arm A, versus arm B. Now you can imagine that in order to do a trial properly and effectively, it takes time. And it takes a lot of preparation, finding the right patient profiles that match each other up, and then following them for a period of time. The challenge with COVID is that we're really designing the plane while we're flying it. And that, I think, is one of the reasons why it could be difficult or frustrating when you listen to some of the news, for example, and people are like, well, we don't really know if this medication works, or we don't really know if that approach works. I think that in the absence of that, I think that a lot of caring physicians and health practitioners are trying to think about the universe of possibilities and trying to match that universe of possibilities with their patients as best they can. And that often leads to combinations like the one that you were talking about. But to the best of my knowledge, a lot of these combinations have not been rigorously tested. So it's very difficult to say with certainty that they are going to provide benefit. And then in some cases, what we really want to make sure is that they're not going to not just not provide benefit, but cause harm. And so it's very difficult to say until we have these trials. But in the meantime, a lot of very well-intentioned people are trying to do the best they can with the medical knowledge that is currently available. So thank you for that wonderful question. We also got a question, if you've had your spleen removed, and are you at higher risk of contracting COVID-19? Well, that's a very interesting question, that your spleen is a very important part of the immune system. And we know that the spleen helps patients protect against encapsulated organisms, many of which are bacterial organisms. So can the spleen being removed increase the risk? Well, we know that if the spleen is removed, it does have an impact on patients' immunocompetence. So in other words, they may have some issues with their immune system's ability to fight. With regards to viruses as COVID in particular, I am unaware whether or not it increases the risk significantly, but in theory, if it does have an impact on the immune system, you can imagine that there may be some interaction there. Most folks who have had their spleen removed may be followed chronically by an infectious disease doctor or a hematologist, and I would direct that question at them to get a more thorough answer in terms of whether or not COVID itself has had a greater impact on patients that have had splenectomy. That being said, I think that we know that splenectomies can compromise the immune system to a degree, and I would certainly take that into consideration in terms of how I went about my day-to-day life and the exposures that I undertook. All right, and along the same lines, I'm hearing that zinc is helpful with alleviating COVID-19 symptoms. Is there any evidence to support this? Again, I think that a lot of what we're seeing with regards to a lot of these medications, minerals that are being tried, are folks that are well-meaning, that are trying to find ways to improve the current situation. To the best of my knowledge, there has been no trial that has shown that effectively, to the best of my knowledge. Okay, so this is actually a very important point to bring out. Along with a question previously asked, are blood clots unique or different in COVID patients? Well, we're finding that a lot of patients that have been infected with COVID, because we believe of this inflammatory response, have had a significant propensity towards forming clots. This is something that I've personally discussed with some of my colleagues, and we feel that in the midst of this inflammatory environment that COVID sets up in the body, it may predispose people to developing blood clots. So we are keenly aware of this. It's something that we're actively looking for. And we also know that sometimes patients, if they get very sick with COVID and have significant inflammatory response, have also had a tendency towards not just thrombosing, which is forming clots, but also bleeding. So it can have a significant effect on the coagulation system, which is a system that causes blood clots to form or dissolve. So this is something this is evolving knowledge that we are currently looking at and specifically aware about. So thank you for pointing that out. Okay, if someone has AFib, are they at higher risk of contracting COVID-19? Well, AFib, as you guys know, is a very common disorder. Millions of Americans have atrial fibrillation. Atrial fibrillation is when the top chamber of the heart loses its normal rhythm, and instead of beating and contracting in a very synchronized way with the bottom chamber of the heart, the ventricle, it will fibrillate. It will beat at a very fast rate. As a result of this, it increases the risk of forming stroke, of forming clot in the atria, and that leading to stroke. So, in terms of atrial fibrillation, one of the main risk factors for AFib is hypertension. High blood pressure chronically can increase the risk of atrial fibrillation. So it wouldn't be crazy to think that patients that have atrial fibrillation and also a history of hypertension may be at increased risk, simply because we know that hypertension is itself one of the main risk factors. And that also happens in patients as they get older. So as you can start to see, a lot of these risk factors tend to live together. And when these risk factors live together, it limits the reserve for any given patient. And then that itself may be one of the reasons why patients may be more susceptible to this virus. So we want to thank you so much for joining us today, and hope that some of the responses could be helpful. This is a very difficult time for all of us, and I encourage you to keep safe and to keep connected. Even though we can't physically see each other often, we want you to know that we're here, and that if we can do something to help you and move your case and your care forward, we will, whether it be through video, through phone, through email, or simply through encouragement. So we wish you well and hope you keep safe and do well. Thank you.